Hi, and welcome to this educational video on expiration management in healthcare supply chain. In this video, you will learn the importance of managing expired products, how products are repurposed, and common terms related to expiration management. This video is presented by Trident Consulting, where it is our mission to provide thoughtful instruction, tips, and guidance on healthcare supply chain topics to passionate supply chain professionals just like you. When it comes to hospital inventory management, expiration date management refers to the process of minimizing the costs associated with products that expire on the shelf and purging expired products from inventory. Two more terms that you may hear are expiration date and expired. What does expiration date mean? When you see an expiration date on medical supplies, this is the date that you can expect the product to remain sterile, safe, and stable. It is also worth noting that the expiration date assigned to medical supplies will vary depending upon the type of product, the packaging, and the environment where the product is typically stored. What does expired mean? Expired means any product that has a use by expiration date or a similar date reference that has exceeded the stated date. Additional terms you may hear include shelf life, expiry date, and expiry. What is shelf life? In normal circumstances, the term shelf life refers to the duration that a product can remain safe, sterile, and stable. In this context, the shelf life of an item can be 5 years, 10 years, etc. In hospital settings, it is common for staff to use the term shelf life to refer to the expiration date. For example, you may hear a colleague say, "Those syringes have exceeded their shelf life." It's a way of saying the products are expired. What is an expiry date? Some hospital staff and medical manufacturers use the term expiry date to refer to expiration date. You may even see or hear the term expiry used to refer to the expiration date. Other concepts to be aware of: the hourglass symbol shown on this slide is a universal symbol that is applied to all packaging when the contents have a restricted shelf life. In the US, the date stamped just to the right of the symbol is also the last date that the product can be used on a patient. It is also worth noting that many packages list an expiration month and year rather than exact expiration date. In the US, when a package lists a month and year as the expiration date, it is common to use the last day of that month as the expiration date. For example, if the expiration date is listed 2024-12, as shown here, the product can be used until December 31st, 2024. Many hospital supplies have expiration dates. In fact, in a recent audit of an OR storeroom by Trident Consulting, we found that 90% of the products had an expiration date. Some of the common hospital supplies that have expiration dates include sterile supplies, bone and tissue implants, syringes, disinfectant solutions, catheters, and sutures. To be clear, the only way to know for sure is to look at the packaging to see if there's an hourglass symbol or an expiration date listed. FIFO, which stands for first in, first out, is an inventory control method in which the first items that are placed on a supply shelf are the first items to leave. From an inventory control perspective, good FIFO practices are essential to an effective expiration date program. This is because FIFO practices are designed to position older lots for first use, and the result is that products have a much higher likelihood of being used before they expire. In other words, good FIFO practices result in a reduction in waste and a corresponding reduction in inventory adjustments. To achieve FIFO in an inventory location requires thoughtful and well-adopted processes throughout the inventory management team. For most hospitals, the FIFO process typically relies on the staff members who put products on the shelves. More specifically, these staff members are required to physically remove older products from a shelf, then load the newer products in the back, followed by returning the older products to the shelf. This approach makes the picking process more likely to result in older products being picked first. However, when staff responsible for inventory put away are pressed for time, It is common for them to place the newer products in front of the older products rather than follow the FIFO process. To improve the FIFO process, some organizations invest in more advanced techniques, such as gravity flow racking, which allows new products to be loaded from the back, the two bin Kanban inventory approach, which inherently leads to newer lots being placed behind or underneath older lots, and software that assigns bin locations dynamically for each receipt. This approach results in pick lists that direct picking staff to the older locations first. Regardless of your organization's approach to FIFO, it is important that you understand your role in the FIFO process, as well as the specific procedures you should follow to support your local FIFO policies. Why expiration management matters. There are several key reasons, including patient safety, hospital costs, and hospital accreditation. Here are some key reasons for focus being applied to a good expiration management program. Expired products are considered unsafe for patient care. A good expiration date management program will reduce the value of products that are wasted. Organizations that accredit hospitals pay close attention to expiration date management because of the direct impact on patient safety. In addition to requiring non compliant organizations to be re audited, it is possible for a hospital to lose its accreditation if they cannot demonstrate effective management of expired products. Based on these crucial factors, it becomes obvious why hospitals must effectively manage products that have expiration dates. To mitigate the risk of expiring products, hospital supply chain departments typically establish proactive processes, such as auditing storage locations, to remove products before they expire. Further, hospitals also typically require all staff who handle products to pay attention to expiration dates during their everyday operational processes, such as receiving, issues, and returns. We will cover both proactive auditing and the operational approach on the next few slides. First, let us discuss auditing of products already on the shelf. As mentioned previously, most hospitals establish processes for auditing products that are sitting on the shelf to avoid having expired products issued to a clinical department or used in patient care. In general, audits are intended as a control process that ensures products already on the shelf have not expired. To be effective, the audits should be performed regularly. To achieve this, the inventory management team will walk the shelves and visually inspect every item that has been identified to have an expiration date. Products that have expired or are within a set number of days of expiring will be removed from the shelf and taken to a designated location in the hospital for reuse in nurse training or other programs that do not have the same restriction on product expiration. If the product is in a storeroom, warehouse, or a point of use location that tracks on hand quantities, the staff member will need to follow the appropriate steps to ensure the on hand quantity is decremented and properly recorded as expired. If this level of detail is tracked in your inventory management software. It is also common for the expiration date process to be combined with FIFO and/or bin cleaning processes. Check with your supervisor to understand exactly how product expiration audits are performed in your organization. Some organizations go a step further and incorporate the movement of older items from a slow moving inventory location to a faster moving location so that clinicians can use these products before they expire. For example, if you have slow moving IV solutions that are 60 days from expiring in a small clinic, you could swap those with products from your hospital emergency department where they use several cases of this product each day. As mentioned previously, there are also operational steps that should be taken to minimize the risk of expired products being put into clinical use at a hospital. More specifically, most organizations require supply chain staff to follow FIFO processes when stocking and issuing products and to pay attention to expiration dates during receiving, issuing, counting, and managing returns. Like the auditing process mentioned in the last two slides, products that have already expired or are within a set number of days of expiring should be taken to a designated location in the hospital for expired products. If the product is perpetually tracked, the staff member will need to ensure the required adjustment transaction is performed to update the stock on hand. By incorporating FIFO in a visual review of expiration dates throughout all your assigned tasks, you'll be supporting the hospital's overarching expiration date management program. More importantly, your attention to product expiration dates will improve patient safety and reduce waste at your organization. There are several options for repurposing expired products when they are purged from inventory. Common examples include donate to nurse training department, donate to mission trips or organizations that can repurpose these products in other countries, recycle the product. There are also companies that can professionally dispose of or destroy products. Your organization may have a partnership with this type of company. Keep in mind that it is never good practice to keep expired items on the shelf, so be sure to use the appropriate solution depending upon your health system's policies. And remember, if everyone pitches in to incorporate FIFO and expiration management processes into their daily routine, the entire health system benefits through improved patient safety and lower costs. Thank you for watching all the way to the end. I hope you enjoyed this video and picked up some valuable information about the management of expired products in a hospital setting. If you enjoyed today's video, please like and subscribe so that we know that you, specifically, would like to see more of this type of content.